All right, it's Friday. We made it through another week here together. This is Coronavirus Inside the Arizona Numbers, our daily deeper dive into the data that's coming out of Arizona specifically. We want to welcome all of you in. I know so many of you are watching from other areas across the country, and you've said that this information applied to Arizona. You have then applied to your home state to find better info and better data out there, and we're so happy for that. Let us know in the comments where you're watching from, if it's right here locally in Arizona or somewhere else across the country. We have a lot to talk about today, as we knew we would, Garrett, because we were waiting here in Arizona for some direction from the state as to when Arizona schools would be allowed to reopen safely. And that information came out to us yesterday. We're going to talk all about that because I know so many of you have questions about your child or your grandchild's school district. So we'll talk about where to find those numbers. We'll help show you where to find all of this information. I want to note as we get started, we have just passed 9 million worldwide cases. We have just passed that marker, and we'll talk about some of the markers specific to Arizona as we make our way through this afternoon. And we have reason finally to celebrate today. Some better news coming in that R naught number, and we'll discuss that range and why we can trust that number a little more than we could last week. We got some leading indicators, but now we can actually go with it. We'll talk about that as we make our way through this afternoon. So thanks for taking time with us today, Garrett. Let's get right into the summary page as we always do. That's coming out of the state of Arizona.
All right, let's go right to the summary page. I'm sharing it now. We start off every single day at this area. It's the summary page right here on the AZDHS dashboard. So let's go through it. As we said, 185,000. That's the total since the pandemic began. 4,081 deaths. And then 1.24 million tests conducted. So today, 1,400 new cases. That's off of 10,000 new tests with 79 deaths reported today. The percent positive for the diagnostic test has gone down yet again. The cumulative positive, we're down to 14.2, and the antibody positive has gone up one tick to 5.5. So both of those are kind of the direction you want to go in, where the antibody positive's going up and the PCR percent positive's going down.
Can you show us Maricopa County specifically on that page too? I want to note that of our counties, our 15 counties there, you can go in and highlight on any of those and see a bit more information about wherever you are watching from. This is a really easy to read website, and that's why we start with it each and every day. But how does Maricopa County look in comparison, Garrett? I know we had 48 of those deaths right here in Maricopa County.
Yes, and you can see that right here, the 48 deaths right here with a total for the county of 2,307. As you can see, the county, Maricopa does have a slightly higher cumulative percent positive rate than the state. It's at 15.5%, but it also has a higher serology at 5.8%. So that's just something to consider. It kind of shows that that Maricopa, being an urban area, was sort of impacted a little bit more aggressively than some of the other rural counties were.
As we always talk about, our hospitalization numbers have gone down, and we'll get to that in just a moment. But I do want to talk about that R naught number. And actually, Annie's commenting on that. Why are you not talking about the RT number? Arizona has the slowest spread in the nation. Annie, we are going to talk about it as promised right off the beginning there. We have dipped even lower, and it's not as important today, the number that we are at, but the range that we are at, Garrett, because we're finally below 1 within our whole possibility of range, not just that number that we've been tracking so closely.
My computer's freezing, so
no, I can share it. I can share it on mine.
Okay, I was gonna say I don't know if I'm freezing as far as the camera's concerned, but I'm certainly frozen on my desktop. So
you are not frozen,
okay.
And in fact, I can share my screen. Are you seeing it now?
I will not be. I don't think I'll be able to see it because my is. But if you tell me it's open, I'll agree with you.
I cannot tell if I'm sharing it either. Let me switch between this.
You know what? Just give me 1 second. I'm going to just talk about the schools for a second. I'm going to drop out and I'll drop right back in as soon as I
okay, sounds good. I'm going to update folks on that. Oh, producer Josh is saying, yeah, he's not seeing it either. Okay, so, well, I can tell people about that range, though, as you work on bringing it up. Arizona has moved to the lowest in the nation. We are now at an estimate of 0.84, and our range within that estimate, so anywhere we could fall, that percent of confidence in there, is 0.64 to 0.99. Now that's important because being below 1 is the key number there. That is really indicating that we're slowing the spread finally. So for those of you who are unfamiliar with that R0 or RT number, it is that key measure in how fast the virus is growing. So it's the average number of people who become infected by an infectious person. So having that range down below the 1 indicates that we can be confident that there's not a possibility we're diving above that number again. So it's good news watching that range bar. We're also at the end of the line. That makes us first in the nation, best in the nation, safest in the nation for that transmission rate only. This is not talking about how many people pass away. It's not talking about how many people end up in the hospital from this. It's better news overall as it pertains to our case count, Garrett.
Yes, absolutely. And just to reiterate what you said, now at this point, we've been talking about this for a couple of weeks now, is that the goal is to see an R0 number that with both error bars under 1. And we're not only are we the only one in the nation right now to have an error bar, basically an entire estimate that is under 1, but we're also the only one that I've seen since we've been recording and tracking this R0 number in all of these states, that we are the only one that has ever been under 1. So, that's sort of two very pretty awesome milestones. That now, again, R0s have their, we always have to talk about this with a grain of salt. R0s do have their inabilities. I mean, they are dependent on the case numbers being reported to the Arizona Department of Health Services. So, as long as the reporting is tracking and actually having a impact on what the community spread numbers are, then this is a good estimate. If for some reason we're in a point where community spread is higher than what is being recorded, then that would be a problem. Now, because of the lack of testing demand right now, it appears that since we've A, gone through our backlog, and B, because of the testing demand, that this is likely a decent estimate at this point. So this is good news all around.
Yeah, really good news. Crystal writes, oh, wow, we have the lowest spread, thumbs up. Yes, Crystal, we have to stay the course, of course, to continue managing this, but it is really good news, really welcome news on this Friday. So when people say, you only report the bad news, we report the good stuff too. We just have to wait until we get there. That's why for so long we've said we're close, we're close, we're close, but there's still a degree of uncertainty. And now that we're under that bar, we can be a little more confident.
Yeah, and that's the thing, is that there's always a degree of uncertainty, but now statistically, at least as far as this estimate is concerned, there is no degree of uncertainty in the calculation any longer. So now any uncertainty that might be applied would be due to data collection and not to, I was reading through this site a little bit more precisely the last couple of days, and they say that one of the things they do is they are using because they do account for delay in tests and sort of that epi curve phenomena we talk about. They do account for that, but they're only using data from Germany to account from that. So as long as and that's people input, Germany inputting the same health data on the epi curve, similar to everyone else that does that. And so they say, as long as other health departments are inputting data in the curve with the same sort of rate as Germany does, then we're pretty confident that this number's good. But that's just another sort of limitation of the model. Whenever you look at these things, you always want to talk about the limitations of the model. So, and said, this is calculated every single day and recalculated, this entire curve. So, even though we're seeing error bars under 1 today, that doesn't necessarily mean that we're going to have error bars under 1 even tomorrow.
Okay. Anne writes back, thank you for talking about this. It is something we rarely hear about, and it is very important. Anne, join us each and every day here. We talk about it right here every single day. It is absolutely, you are right, something important, and that's why we are sure to touch on it. We spend about 45 minutes here each day talking about this data, and I welcome all of you, and I'm seeing so many good questions. We have so much to get to today, as I knew we would. But Garrett, we need to move on to, and this is not to get political in any way, but there has been a big conversation today about this back and forth between Governor Doug Ducey and former Vice President Joe Biden. And they went back and forth today. And it is specifically, we want to stay specifically with the data in all of this. Was it a timing thing in their discussion? Did one person have some outdated numbers? What's the truth to this here so that we can understand? I know our best data is always our most recent data, but looking at where we've been in Arizona, we were in good shape, and then boy, were we in a mess, one of the worst in the country, and now we can see some of our leading indicators saying that we're better. What happened here between this conversation?
Sure. So I'll take it through the timeline very quickly. I've got my screen shared to Twitter. I'm not going to go through everything that was said, but Joe Biden was talking about Trump calling Arizona a model for applying a science-based approach. He then makes some criticisms against Doug Ducey regarding some of the decisions he made. But we're not going to focus on those. We're going to focus on this right here, which is this is Joe Biden's sort of data proof to back up his standing. So he says an infection rate that is still nearly 20%, the fifth highest number of current hospitalizations in the country, more than 4,000 deaths, 183,000 cases, and a lengthy delay of test. So, and then before we go through that, we'll go to Doug so we can see the governor's responses. He does go to, let's see, it's just going to take me a second to find it. He then, come on, there you go. So he decides to make a statement in defense to Joe Biden, saying that the percent positivity rate is between 9 and 11%. The R naught number is 0.86, and then the testing sites are growing. So you see sort of data between two politicians going around and trying to figure out which one is correct. So this is sort of where these issues come into play. Joe Biden was using slightly outdated information. That is absolutely true. He's using the COVIDtracking.com percent positives that are given out that they take from Arizona Department of Health. So when we've already talked about the fact that because the serology numbers, the antibody numbers are going up, our percent positive right now, as displayed by COVIDtracking.com, is inflated. There's no denying it's inflated. So, when he says that we have a rate of 20% positivity, that's just no longer the case, and it hasn't been the case for quite some time. So Doug Ducey actually sort of wins that part of it, because Doug Ducey was using the epi curve numbers, saying, look, you're looking at these 20% rates from COVID tracking, but we have a 9 to 11% on our epi curve, which is, I wouldn't use the 9% because that's incomplete data, but the 11% is accurate. So the latest week that we have full data for is 11%, which is much closer to what our numbers are. As far as the hospitalizations, I haven't checked that, but it's easier to presume that one is more accurate. Obviously, the case and the death numbers were accurate, but we also do not have a testing delay at this point. So Joe Biden was also operating, or at least the campaign was operating off of sort of older information as well, saying that, well, there's delay in testing. And we just, again, we're not detecting any delay of testing anymore at all.
Right. And we do want to clear that up, because I'm seeing that from other people posting as well, that, there's a huge delay. You can go right in and sign up for a test. I got my test back within 48 hours, drove right up. I mean, took 20 minutes. I was not in a long line at all. It just sign up for one if you'd like to get one. Do I need a COVID-19test.com is the site to go find that information and find that location that works best for you and the style test that works best for you. Once again, do I need a COVID-19test.com? Thank you for clearing that up on that back and forth on the internet today, on Twitter today. I know we're going to have a little bit more on that coming up at 4, 5, 6, and 10 p.m. if you want to catch that reporting. But Garrett, that helps. Usually when we see this stuff, both people are right. It's just the timing of the snapshot of when that happened. And that's why we talk about data every single day here, because day to day, the situation changes. We can track trends and smooth out anomalies, but things can be different when it's picked.
Yeah, and this is a weakness of sort of the reporting structure in all the states, really. This is a weakness that is in all the jurisdictions. So, when I look at, which we've been to before, 91dvoc.com. I'll share that really quick so people can see it. This takes data directly from what's it called? COVIDtracking.com. Mm-hmm. So when I look at the test percent positivity of DVOC 91, right now it's saying, it says 14% right now, but only a few weeks ago it was saying 18% only 2 days ago. This is using the reported number. the COVID-19, the COVIDtracking.com number. So this is showing that higher number, but then when I go to, I'm going to take this off and I'm going to move it back to the AZDHS site really quick. And I'm going to go to the laboratory testing. I'm going to take you down here to the epi curves. And this is where the sort of disagreement was. And this has been a constant disagreement as far as how this data is interpreted. These are the numbers that Doug Ducey was using. This is the actual date of collection for the percent positive. So this is saying, the AZDHS is saying that 11% of tests collected between July 26th and August 1st are 11% of those were positive. And anything after August 1st, 9% is positive. So as you can see, the epi curve data, especially because of that delay in reporting we had, is significantly lower than the percent positive that's being reported out by COVID tracking. And you can see that here too, right here in the antibodies. You can see our antibody percentages growing by leaps and bounds. This wasn't an issue back in May when our antibody positives were only 3.5%, but now they're up in the 13, 14, 15%. So they're really impacting that percent positive that COVIDtracking.com and Johns Hopkins University is using.
All right, let's see. Oh, Cindy is saying exactly what I was saying. She got right in yesterday, no long lines. So some of you that are posting it's taking 13 days, it was taking that long to get a test. That has now been shored up and changed. So the very latest information we can tell you is it's taking anywhere from 1 to 3 to 4 days to get information back on a test right now. And there are not the lines that we saw in past weeks. All right, let's get to schools.
Yeah, let's get to schools.
Everybody's talking about that. So for those of you who are not in Arizona, there are basically 3 metrics that came out that we need to track to see when schools are safe to reopen. Garrett, that is the average number of new cases going down for 2 weeks. Now, most counties have hit that marker already.
Yes, I do have the benchmarks ready to go, so I have them saved.
Awesome. Yeah, let's put that up.
So this is these are the benchmarks here. So you can see cases. You can see the cases as 2 weeks below 100 cases per 100,000, or a decline in weekly averages for cases for 2 consecutive weeks. And that is, and then here's the percent positivity. 2 weeks with percent positivity below 7%, not including the current week. That is an indication to me that they are using the epi curve data to do this. They are not using the percent positive as reported by Johns Hopkins University or COVID tracking, because they're saying, we know that the most recent week will not be complete, so we're taking the 2 weeks prior to that to make sure that we're making that 7% threshold. And then the COVID-like illness, the CDC run surveillance system to check symptoms at hospitals, they're also going to have that. They want to see that below 10% for 2 weeks, which I believe we've already achieved that at this point.
So some of the counties, they also put out a sheet that has county by county who is in which category and of the 3, and who still has a way to go. Do we have that particular sheet?
I have. Is that a sheet or is that a dashboard? Because
I actually shared that on my Facebook page. If there was anyone interested in that number, it is. It's just an easy spreadsheet that has each county, all 15 counties, and then it's got 3 sections, so you can see who they've kind of checked off and who's left with a red X on there. So I can even.
I will share the dashboard for now, and then we'll see if we can find that other one. But we do have a link to the dashboard. This is where you're going to go to track the schools opening. It's on this dashboard, I believe. And it's a redirect. So there it is, azhealth.gov/schools COVID-19. And this is the dashboard they're using to show this. So if you can see, we click on a county. We'll click on Mojave for now. And you can see that according to the dashboard, they believe that Mojave has met, or they say that Mojave has met the first criteria of a decline in cases of less than 100 cases per 100 individuals. They have not made the 7% benchmark for percent positivity, and they have had 2 weeks consecutive hospital visits for COVID-like illnesses under 10%. So they say Mojave is their two of 3 of the gating criteria. We'll go to Maricopa because we know that's the biggest county. We can see that Maricopa does meet the criteria for the decline in less than 100 cases per 100,000 individuals. It does not meet the criteria for the 7% positivity benchmark, and it does not meet the COVID-like illness for 2 weeks. Now you can see the date is a little delayed here. It's July 19th, but these are the numbers they're looking at right now.
So Garrett, when we see this page, correct me if I'm wrong, it sounds like they're only going to be calculating and recalculating this once a week on Thursdays.
Yes, this is a weekly checkup on the data. So this looks like this will be changed every Thursday. So do not expect to see differences in this data on a daily basis. We'll go back to this on Thursdays when they make adjustments.
Yeah, Thursdays are going to be a big afternoon for us as we catch up on these numbers. So let's see. Alice writes, my niece is not returning to school the first semester. You know what? My kids aren't either, Alice. In their school district, they were one of the early ones to say we're not going to start in person until October. And for those of you watching from other places, we have a fall break here in Arizona in October, and that's when these several school districts have now decided they're not even going to worry about this. A lot of parents felt like this was too much watching all the numbers and just get me something settled and let me plan my life and get going on this. And it'll be interesting to see if we meet any of those benchmarks, like how much earlier we can meet those benchmarks before some of the dates that were set by all these different school districts. So Garrett, I have to ask you, there is a conversation that's going on online, and a lot of you have emailed this to me at the station. A lot of you have friends who have texted me who have kids here, are asking about this. Okay, they want to go and get tested because they believe that they do not have COVID present in their system, and they would like to go sort of push the numbers to get closer to that 7% because they believe that they will show up as a negative out there. That would take a whole lot of parents going to a whole lot of testing sites to try to get that number to go lower on their own. Is that something that would even be possible? I mean, what are we talking about here? Tens of thousands of parents trying to go and take a day off of work. And yes, there are not lines out there now to go get tested, but if you sent 60,000 people out to State Farm Stadium to go take a swab or a saliva test, there's going to be lines out there. So is this something that's even feasible for parents to try to push that number or will that number closer to get their kids back to in-person learning?
So don't get me wrong. I definitely want to see more community testing if needed. So if people do feel like they would like to get tested out there, more testing does give us a better idea what the spread is like in the community. Now that being said, if you're going out and getting tested once a day and trying to push the numbers down. So say you go, every single consecutive day saying, well, if we can get 1,000 people to get tested every single day, we can push that number down. I mean, well, I guess technically that is true. You could technically do that. There's some issues with that. First of all, you're going to need a lot of people. And like you said, a lot of times you're also going to have to, you're either going to be paying for the test on a daily basis, or you're going to have to go to a free place to get the test. And these places, they do have data checks. So if they start detecting like the same 5 people are coming in every morning to get a test, they're gonna be like, why is this person coming in every single morning to get a test? So that sort of makes this infeasible to try to sort of game the system. Now, if you're just going to get tested because you want to see the number go down, but you're just going to go out once to get a community test, I think everybody should, consider looking to increase that community testing. I don't want to advise anyone to get testing if they don't need it, but community testing is definitely a good thing.
Yeah, as I said, if you're curious, get a test. If you have even one symptom, go get a test. All right, Luke Garrison with these cute little kids in the picture is asking, once schools open in person, how long will it take to truly know if it's causing a case increase?
What I would say to that is that as we've talked about before, we do have about a 2-week delay in reporting with numbers a lot. So the good, here's sort of the good, is that we know now that Sonora Quest is turning around most of their tests within 2 to 4 days at this point. So that makes it a little bit better as far as being able to see when and if and when a curve starts to change. One of the biggest issues we had in May and June is the the curve came aggressively, and we didn't have a way to respond to it because we didn't have the testing capacity. The delays were 7 to 10 days. There was no way to really respond to a significant surge like we had in late May, early June. Nowadays, it would be a little easier to not only we have the capacity, and we would also be able to detect this a lot better. So as the day is concerned, I mean, I would say, if I had to put on my forecasting hat, I'd say, it would take at least 2 weeks, possibly a month, for us to really detect if there's been a serious surge.
Yeah, it's something that obviously we'll watch closely. Really good question. Thank you to Luke Garrison for that question. So many more questions coming in. I do want to note that we passed 1 million PCR tests now here in Arizona. We talked about when we passed 1 million tests overall here in Arizona, but 1 million PCR is important as well.
Absolutely. The diagnostic test, that's one of the problems with the curve data we just talked about, is that it's also including percent positive for the antibodies. Now, the AZDHS did update the dashboard today. This is kind of geeks in the group that are really watching the data and crunching the numbers. They actually now provide in that EpiCurve test positive a way to actually see which labs are reporting electronically, which now that they're doing that, it gives us a better idea of what the actual numbers of antibodies are coming in lab. So we can now calculate that number properly. So we're not sitting there thinking, we've got this inflated numbers. We did several stories back when they opened up by the fact that we could not get to their the number that the governor was using. Even the numbers on the dashboard at the time were higher than the governor was saying. So, I mean, now we have the ability to at least, calculate and follow what the governor's math is. So when they do declare, oh, we're open, or we made our threshold, there now could be some independent auditing on that data.
Okay, so Garrett, I know that the school districts will only be looking at that information, as I mentioned, once a week on Thursdays. Is there a place, though, that we can show folks to find the day by day in that? Now, obviously, looking at a 7-day or looking at some way to smooth out any anomalies in those up and down numbers, but for those people that just cannot wait and are waiting for those numbers every single day, where is the safest or best place, most accurate place to track that?
Well, there's only one place to truly track that, and that is the AZDHS's dashboard. So we're going to go to there. I'm going to take you there. I've got it shared and ready to go. It's at laboratory testing, and you come down here, and there are these 2 bars. They're not great. They're really small. I wish they were a little easier, or you could expand them. But if you can see sort of right here, there's these 2 little plus. There's a plus and a minus. You can push that plus button, and then it takes all of the tests by day. And this is updated to the day. So unlike the school dashboard, this one is updated every single day as the most current information into it, whereas the school dashboard looks like it's going to be at least 2 weeks behind at all times. So this one you can actually see, this is what I was talking about. You can see number of positive tests reported electronically, 532. The number of tests reported, positive electronically was 532. And the number of tests reported electronically in total was 6,376. And then you can also see here, hard to get to, but if you can hit that little red line there. Oh, that dot, where are you, dot?
So elusive.
It's so hard to do now because there's just so many days on this. So I'll come back here and see it. 7%. So there was 140 tests electronically, and that was a 7% rate for the day of August 5th. So you can check this every single day. I'm actually recording this data every single day. I'm going to have to make some adjustments to with the changes they just made, but we'll get this back online in a couple days as far as our tracking, and then we'll produce some more data points and some more data curves, or a little more easily readable graphs with this data.
Garrett, this has been our between you and I, our most popular section of the dashboard there. We've always scrolled down to take a closer look at that. So it's interesting that that's become such a hot area as well to track all of this. All right, Brant writes, thank you, Katie and Garrett. Really good information. Thank you, Brant, for saying so. Thanks for joining us on here. I know Brant has joined us on here a few times, concerned about his kids and schooling and all of that. So thank you for taking time with us. we will definitely take time for that every Thursday when we're addressing those new numbers. But we're happy to take questions throughout the week as well as we continue to track all of these. Okay, we have not spent any time, and I know we've already been talking for 30 minutes now. Let's get to some of the hospitalization numbers. Still trending down, not in all categories, but in many. And overall, it's a better, healthier storyline.
Yep, it is absolutely. And I will go back to the hospitalization. I go back to the dashboard, of course. That's where all this data is. We'll look at the census numbers first, just to get an idea of what's going on in the entire census. Again, this number is COVID-19 agnostic. This is simply a bed count of the number of occupied beds in a hospital. This is the ICU adult beds. We can see about 84% of them are occupied at this point. That is the lowest number since about middle of June, before we started spiking up to the 90s. So we're about at those levels. Emergency department census numbers have stayed fairly steady this entire time. Inpatient, this is the general acute care beds, and you can see again 83% on those. Ventilator usage, I believe, is at a low part. Yeah, 39%. We're under 40% for that number now. And then COVID-19 specific metrics. We'll start here with the inpatient, the general acute care. We had a huge drop today, 100 patient drop today in the general acute care. So now we're down to 1772. That is the lowest since it looks like about here about 618, 617. So we're almost on the complete other end of the curve when it comes to the inpatient numbers. Again, a low point since our highs on ventilator usage. ICUs also dropping pretty significantly today, about 30. COVID-19 discharges, a little noisier. You can see discharges are going down, but hospitalizations are going down, so that's expected. And then emergency room, as you can see, we talked about this yesterday, how the curve is going down, but it's starting to slow. And this is interesting because emergency room departments can be the most leading indicator we have for COVID-19 and what's happening in the hospitals. So what this is telling me is there's a chance that we might start seeing a slowing in the inpatient and ICU beds as far as that decrease. That may happen, but it could happen. And then intubations have stayed level for the last 3 days.
So overall, some much better news in all of this, and we'll continue to track the hospital numbers for sure. Let's see. I want to get to some of the questions from everybody that's joining us on here. I'm not going to pronounce your name right. Miss Casey writes, at once, all the children are going back to school on campuses. That'll be high numbers of COVID-19. We will definitely be tracking all of this. At this point, the only schools, it sounds like, Garrett, that are back are private schools, if a few private schools around the Valley have chosen to do that.
Exactly. And what we've been, so this is what we know. We know, first of all, there is obviously a possibility for anything can happen. This is a 100-year event. We don't know what's going to happen when everybody goes back to school. But we do know, as we talked about when Luke was asked that question, that we have we should be able to detect, at least we'll be able to detect an increase within 2 weeks. It'll take a month for it to shake out, but we'll be able to say, within 2 weeks, we'll be like, something has happened. Our percent positives are starting to increase. We need to figure out what's going on. So that is definitely a possibility. And then also, we're told that Maricopa County at some point is going to put together a mapping system for COVID cases by district. We haven't seen it yet, but it is something that they said they're going to do. And we're looking forward to that being done and seeing what it looks like. Maricopa County has one of the best GIS departments in the country, in my opinion. So when they put their minds to it, it's going to look pretty fantastic.
Yeah, so we're waiting for that. I'm glad you brought that up because that was something that they talked about in their news conference earlier this week and something that we've been hopeful to see. How much variation, though, do you think that we'll even see school district to school district? I know that looking at some of the zip code maps kind of helps to give us an indication of how things look around the Valley. But then would that even be safe, say, to have, just because you have higher numbers in one section of the Valley to open the other, doesn't mean that these kids' parents aren't working in that other city, or that it's not, it doesn't stop at the end of one particular zip code.
Exactly right. That's one of the big issues as well, is that, we live in a very urban sprawl county in Maricopa. And so there's a lot of transit between areas of the valley. I mean, I know plenty of people that live in the East Valley and work in Phoenix, and in many ways vice versa. You've got ASU students all over the place in the valley. So you're totally right. It is definitely, you look at these numbers by district, but that doesn't necessarily mean that they don't interrelate with each other.
Yeah. Trisha's asking when do we get district to district? Trisha, we don't know at this point. We're hoping it's very soon. They didn't put a timestamp on when they're going to have that out for us, but we hope very soon. Rita was just asking a question about the death numbers. Let me see if I can get back to her question. Why are we having really high numbers in deaths? Every day is a very high number. So Rita, keep in mind, we're going to, as predicted, as we talked about early this summer, you're going to see that crest of each of these categories. So first diagnosis and then hospitalizations. We're in that death high track right now. And Garrett, I think your chart had last said that as we plug these dates back in, these dates of death onto that graph, that we're still now tracking July 15th and 17th as the highest days of Arizonans that we've lost so far. I forget how high those numbers were, but we had dual high dates there.
So that's something interesting about that. So I'm going to bring up the death curve in the one that I make because it's got a little more information on it than what we get from the AZDHS. So you can see the dark blue was on the curve yesterday, and the light blue was added in that last the 78 that were added today. And what's interesting about this, and this has been occurring more recently then it's been happening more and more frequently, is we're seeing these deaths being spread across a much longer period of time. So these higher numbers. So it appears, as you can see, the deaths have been going down pretty substantially in Arizona. But when they're adding these higher death numbers, they're being added to a longer time period. I mean, they really are continually adding numbers all the way from mid-June to August. So even though we had a high death number today, it's going through the entire month. That's very, very likely death certificate matching. And they're going back through with county medical examiners, hospitals, and other places, and picking up the codes if they had missed it to get these deaths actually recorded properly. And we've been seeing a lot more of that recently. Because we have been having some fairly high death numbers, but they have not translated into the curve advancing past this mid-early July numbers that we have. I mean, as you can see, there was a time back in late June or early July that the death number was advancing to where it stops right here, like around July 15th. And so we were getting these peak death numbers advancing, and then it just drops off right here. And that's even though I've said before, I'm always skeptic about how this I don't want to say I'm skeptical about how the data is added, but I'm always conscious about what's going on with the 7-day rolling average. So I give this one a 10-day window to stabilize. But you can see they're just adding it all over the place. So it's sort of it's just kind of hard to know what's really going on with deaths right now, but it does appear very much like that our deaths are going down and at a pretty steep descent.
Yeah. So while the numbers can still be shocking day to day, it's getting to be some better news in all of this. Diane is asking about younger children getting tested. Yes, Diane, I have to scroll back to find your exact question. Have any younger children been tested? Many children have been tested, Diane, and we actually have the case count. Sadly, and I can't even imagine going through this as a parent or a grandparent. We have lost 11 people under the age of 20 here in Arizona to COVID-19. Now, as far as the numbers go, what are we at now for Garrett for COVID among children? It's got to be over 20,000 children in Arizona at this point.
I'm going to it right now, and it's slightly over 20. It's 22,433 that is under that age group, that under 20 age group. I've got it shared on my screen here, and you can see it's the third largest category of ages, and we've talked about this before. It is as far as per capita is concerned, it is the lowest impacted age group right now, but it's also, again, today, it is growing a slightly faster than the other age groups. Nowhere near what it was like for the 20 to 44-year-olds back in May when we opened up, but it's growing slightly faster rate right now than ever.
Yeah. By the way, John's just writing, I got my results in 1 day. That's great news, John. Yeah, it is. People are getting their answers back a lot faster, which is great news because, like I said, I only had to wait 3 days, but it felt like the longest 3 days ever when you're waiting for that.
We have no. I looked at some Northwest. Let me see if I have that up really quick. It's Northwest's dash, and they've actually basically they have not even. They've always had a pending number. Even back. We had a huge problem with testing. They had a pending number. It had some number in it. They don't even display a pending number anymore because they're basically turning everything out for the most part. So, and I'm looking at this right now. Yep, I'm looking at it just to make sure, and there is no pending number again. So, Quest Labs, ASU, they're turning everything out. There's nothing in.
Yeah, ASU will say less than 48 hours. All right, Virginia is asking, has the demand for testing really fallen? Or has the number of tests fallen? So we have plenty of tests now. We have plenty of the reagent. We have plenty of the processing. I mean, none of this, we don't have any holdups at any place anymore. We don't have the long lines. If you want to get tested, basically you can now.
Yeah, we are not detecting any lag anywhere. There used to be at our worst, I think we had a 16 to 18 day lag, and we're not detecting anything. I mean, I said I like to keep a 7-day rolling average. But we're now getting lags of, like I said, 4 days. So most people are getting their results back in 4 days or less.
Rihanna is asking, where can I see the benchmark per county for schools reopening? Rihanna, I'm just going to send you to my Facebook page because I, about 2 posts ago, just posted it. And my Facebook page is facebook.com/news from Katie. It's just got that graphic on there. I'll be sure to update that every Thursday as the new check mark. It's basically X's and O's on there as each chart comes out. So that's the best way to find it. Thank you for the question. Yeah, she said she didn't see it on the AZDHS site. It's hard to find on there, Garrett. I feel like the schools section should be moved up to the top. We're moving it up as we talk about it here. It's a little hidden deep on that site right now.
I got a feeling that it's going to be a lot easier to find by Monday. We'll find out.
Yeah. We sure hope so. It's funny. You and I talk about some of that stuff on here, whether we like the placement on the website, not to be a critic of where it is, but then it all of a sudden changes. So we're happy if they're watching, and we're happy to let people know where to find this stuff. Let's see. Denny writes, are people tested more than once as positive, listed again as positive? No, Denny, they actually work to deduplicate that. So they're keeping your record just like a medical record with your name and date of birth. And so that is deduplicated. So if somebody goes and gets tested 100 times and 100 times they're positive, they're counted once. So really good question. And we always like to make sure we get that answer. Oh, Rihanna's writing, thank you, with a heart. You're so welcome. Hopefully you can find that. If you don't, just message me and I'll make sure that you get that information. Kristen's writing, will Ducey be speaking today? No, he is in Washington, D.C. He's at the White House. I should say he's speaking.
He's back now. He's back, but he's not speaking today.
He's not holding a news conference, is what we should say. I think that's the question everybody's always asking. Usually we have to jump off here and stop answering questions by 3 o'clock because he's speaking about that. Debbie is asking, when is Ducey speaking about opening bars and gyms? So I did see, Garrett, I don't know if you noticed it, on the top of AZDHS. Yeah, okay, so on the top banner of the Department of Health Services site, they have some more information as they're preparing to put out the guidelines for bars and gyms and everything that's been sort of talked about here in Arizona on when they can reopen. I know that they took it back to court and they basically said, you've got to put out some guidelines so that they can say whether they've met those or not. We haven't heard the guidelines yet, though.
No, we haven't yet. No, but it was denied. The motions were denied on Ducey's part, so he does have to put out the guidelines.
Okay. All right. Hey, we're running out of time here. we've got other stuff to get to today. You guys had such good questions, and I wish we could stay with you longer and continue to answer some of these. Listen, we're here every afternoon at about this time. We get to spend about 45 minutes with you going through the questions, and we appreciate all the awesome questions today. More than you know. My gosh, more than you know. And as always, you can find our reporting at abc15.com/coronavirus. And we're here for you in the afternoons as well as the mornings. We're getting ready for our afternoon newscasts at 4, 5, 6, and 10 p.m. And you can find us on Twitter. Garrett's at Garrett_Archer, and I am at Katie Rammel. I already mentioned my Facebook page, a great place to find us as well. We will see you back here on Monday afternoon. Please be safe out there, everybody.